Well, welcome everyone. We'll go ahead and get started to this coffee break with Greenwald Research. I'm Doug Kincaid. If this is your first coffee break that you've been with us for, it's a series of short conversations that we do every month on new research or important topics, usually in relation to health and wealth, obviously, but trying to cover things that are of note. A couple of things to point out just as we get started. One is that as you got notified, we're recording this. That's in part so that we can post it to our website next Monday. So you can share it with colleagues or what have you. The other thing to point out is that this is supposed to be informal. So if you have questions or comments, feel free to interrupt at any time, or you can chat them in the chat box and we'll try and address any questions or comments that you have as we're going along. As you can see from the title today, the topic that we're talking about has to do with mental health issues. And we are doing it in part because this is Mental Health Awareness Month. So timely on that front, but also I think easy to say that the last 12 months should be Mental Health Awareness Year because we've been facing this unprecedented global pandemic that's on top of all of the social, political issues that we've faced. And that's all sitting on top of kind of the normal year of stress and issues that people face. So it's a critical topic, no doubt, and timely for the month. But I also think something that market research has a lot to say about. It can help us understand how widespread these issues are, what implications it has for the workplace, personal finances, overall health, and what it means for employee benefits and the resources that people want to help address these issues. So today we have a couple of experts here, Lisa Greenwald and Edna Vasquez-Dretzka, who are going to talk about some of the research that we've seen in the last year, and importantly, what the implications for this mean on the topic of health. Just to set the stage, and I won't talk long, but Quincy, if you can go to the next slide. Wanted to kind of put this point out there of how notable the past year has actually been, because I think it's easy to kind of normalize what we've been living under as just kind of getting through the year. The census and the NCHS has been tracking the percent who are reporting symptoms of anxiety or depression over, is kind of a weekly tracker that they've been doing. And you can see starting at about this time last year, about 30 to 40%, and even a little bit over 40% in November, oddly enough, have reported symptoms of anxiety or depression. And I just want to pause to consider 30 to 40% of all adult Americans is a massive number who are facing these issues. And it's even more notable when you look at it compared to what we saw in 2019, which was just 11%. So it's more than tripled the amount who are feeling these issues of anxiety and depression over the past year. And as you can see, we've just been rolling through 12 months of kind of unwavering issues on this front. So this is unprecedented. I think easy to believe this, but also something that is extremely notable in how different this year has actually been. If you go to the next slide. Also wanted to point out that it's not just about these acute mental health issues that we should be thinking about. Many of you may have seen this New York Times article that was kind of super viral a couple of weeks ago, in part because I think it resonated with so many people in this context that we're in. And it's this story about this feeling of languishing, which is not this acute mental health status of being depressed, and it's not the opposite of flourishing. It's that kind of weird middle ground that we often ignore of the absence of well-being, not functioning at full capacity, and just feeling like you're languishing, feeling like you're living a blah life at the moment. And they've actually seen that this, dulls motivation, it impacts focus, it impacts your work, and importantly, it's a major flag for major depression and future mental illness. So something that is not new to this year, certainly, just like the idea of depression and anxiety is not new, but we've been living in this heightened level of all of these things for the past 12 months. And it's worth really kind of trying to understand what this means for everyone and going forward. And Lisa, I wanted to turn it to you because I know this is also something that we've seen in our data on languishing and mental health issues as well.
Sure. Thanks, Doug. And hi, everyone. Yes, I mean, that article of languishing, I think, resonated with me personally. It resonated with the Greenwald staff when I shared it on our team's channel. And we've seen some of this in research we've conducted recently. So I'll share a few snippets. The stuff I'm going to be showing you is focused on workers age 50 and older. Happens to be the age group we were surveying at the time. I know that audience may surprise some of you as a Greenwald specialty. But I was, in light of all of this, taking a new look at this data and seeing, really somewhere between 2 and 10 and 4 and 10, feeling these more negative emotions. On the right, 30% feeling scared, and nearly as many saying they feel depressed. What was also interesting is, unlike a lot of the scales we use in surveys, the midpoint on this scale was not a neither. It was not a neutral. It was both the same, both equally. And so if you add those blue bars with the purple bars, what you're really seeing for depression alone is almost 2/3 of workers age 50 and up feeling some type of depression. And that's fairly significant. We asked about the impact of COVID in an open-ended question in the same survey, Rethinking Retirement. And on the next slide, you can see the #1 impact was feelings of isolation. Not too surprisingly, given the quarantine of the past year or so. But isolation was #1. I also thought smaller percentages, but not insignificant. You have, 7% saying they're afraid. They're afraid from a health perspective. And then 1 in 20 saying stress, depression, and worse mental health more explicitly. And then even there at the bottom, a lack of trust. All of those point to a collective mental health that may be in jeopardy, or in jeopardy for a sizable share of the population. You can see the quotes there: feeling alone, hiding my feelings, constantly worrying. And Greenwald asks employees about worrying very often in our research. And on the next slide, you can see some of those more standard battery questions. So the one on top here, thinking about your financial future makes you feel stressed. That was fielded in July of 2020. And we see that over half agree that thinking about their financial future makes them feel stressed. I think oftentimes languishing blah gets expressed as stress in the workforce. And then below that, December of 2020, we asked if they were spending more time worrying about finances because of COVID, and nearly half said yes. And this is important taken together, because people who are not feeling well, who are feeling anxious, depressed, I don't have survey stats on this, you'll have to trust me, struggle to make good decisions. And they struggle, as the article had suggested, with the motivation and the initiative to make good decisions. we all know inertia can be a very powerful thing. So as we try to emerge from the pandemic and make changes at the workplace and with workplace benefits, I think it's important to consider what employees' mental state is and may be as we urge them to make even more change potentially. So speaking of things at the workplace, on the next slide, the 2020 Workplace Wellness Survey, again fielded July of 2020, asked workers to rate their employers' efforts to improve separately their financial well-being, their emotional well-being, and their physical well-being. And generally speaking, it's split about a third, with a third saying excellent or very good, roughly a third saying good, and about a third saying poor. But it skews slightly for emotional well-being. So 34% said their employer's efforts to help with emotional well-being was excellent or very good. But 37% said the employer's efforts on emotional well-being was fair or poor. And that's not to say employers didn't step up. On the next slide, employees said they saw increased effort. They believe their employers have made an improved effort to help with overall well-being. Specifically on the next slide, they rate their employers' communications about mental health and work-life balance fairly high, 37% rated excellent or very good. You throw the purple good folks in there and it's nearly 2/3 who say their employer is communicating about mental health and work-life balance. And to Doug's point, that's certainly been, I think, a necessity over the past year, and maybe one of those things that continues post-pandemic. And I want to talk, I want to turn it over to Edna to talk about mental health and mental health coverage more from the healthcare perspective.
Thanks, Lisa. So, a lot of us and most Americans get our health coverage through our group sponsor, through our employers. And so I think that the employer role in this is extremely important. And so I'm really glad you're starting there, Lisa. If you go to the next slide, Quincy, what we see here is that when I didn't realize you'd already switched. When employees go and look for what kind of health insurance coverage they want, one of their major considerations is whether or not they're going to get mental health coverage. So here you'll see, 2 in 10 are looking for that coverage. If you look at whether it's a major or a minor consideration, that's an even larger percentage of employees. Having access to this sort of coverage is really important. And it's the employer's role, I think, to help educate and guide their employees in making sure that they know about some of those offerings. So if you go to the next slide, what I wanted to do is switch gears. There's another survey that we run each year. We've been doing it now for 15 years that covers the consumer engagement in healthcare perspective. So these are folks that are between 18 to 64. They're people who are on, or 21 to 64. They're on some sort of private health insurance plan. So they're not on Medicaid, Medicare. They're typically through some sort of group sponsored coverage. And so one of the things we've been tracking over time is wellness programming that's been offered by their employees, by their employers, and their uptake of that. In 2020, when we looked at it, we added this new category of behavioral and mental health counseling. Prior to 2020, we had really kind of bucketed all of this mental health resource and support through the counseling and stress management, which you'll see at the bottom of the screen here. But in 2020, we really wanted to offer up a whole category dedicated to behavioral and mental health counseling. And it turns out that a large percentage of employers are providing this to their employees. At least employees know about it this year, right? 47% of them are saying they're getting some access to behavioral and mental health counseling sponsored by an employer or sponsored through their plan there. This is really important if you combine this with the previous slide, that this is an area where folks are really looking for support. And the fact that their employers are meeting them where they are and what they need really is helpful. If we go to the next slide. What is slightly disappointing, and this is something we've seen over the years, it's not new for sure, is the actual uptake of programs that are offered. So while employees are looking for much of this assistance and help and guidance, only 4 in 10 are actually using the wellness programming that's offered to them. This past year in 2020, we didn't ask about specific programs that they took up. So I don't have the exact number that took up the behavioral or mental health programming, but overall, I think it's safe to say that there's more that can be done by employers to really help employees learn about their options and find ways to meet them where they are so that they feel comfortable using a lot of those options. If we go to the next slide here. One of those areas that I think is very interesting is how people are dealing with this on their own, though. We know they've been given resources by their employers, but a lot of them are actually taking matters into their own hands. So when we ask folks, what are you doing to improve your overall wellness this year? We're seeing 7 out of 10, first of all, are doing something. And it's broken down below. You'll see the activities that they're doing in order to improve their overall wellness are not necessarily related to what's being offered by the employer at all. They're trying to exercise more, improve their diet, sleep more, manage their stress. Financial planning, 2 in 10 are taking steps there, and a very small percentage are working on their smoking cessation. But really what we're seeing is that the improvement that consumers are making in their overall health and well-being and try to manage some of this stress and manage this languishing feeling, they are shouldering by themselves. I see we just got in the chat here, I believe Ruth wanted to go back to the mental health wellness slide. This one here. Okay.
Next one.
Yeah. And so if you have a specific question, Ruth, feel free to pop that in the chat.
Quincy, I think the next one with the list. Yeah, I think that's.
Okay. Right. And so I think the takeaway we have here is that, and this is something that we've seen in many of our surveys, that just because it's offered doesn't mean that it's really getting the full purpose or really reaching its full intent with the intended audience. And so this gap here, I think, is one area that we're going to be looking to employers to fill and also to employees to kind of take it upon themselves to say what they need to do to take advantage of more of these programs. Okay, Ruth, thanks. So as we move forward, we see that one area where employers and insurance carriers have really stepped up is meeting people where they are in terms of access to healthcare. And telemedicine has been very important in this. Telemedicine has been one of those initiatives that has been talked about for a long period of time, but we really didn't see a lot of major changes until this pandemic, really. And it was out of necessity, but it was also generated not just by the insurance companies and the employers, but actual state regulations that changed, making telemedicine more available and more cost effective for doctors to participate in as well. So we did see this year versus 2017 that there was a 20% increase in the use of telemedicine. That's major, right? And what we were seeing is that it didn't necessarily hit all populations equally. There were some areas and some populations that really seemed to take it up more than others. It probably has a lot to do with state regulations, but this is going to be something we're going to keep an eye on as we go forward, especially in this survey, but also in others, to see where that telemedicine is gaining traction and where it isn't, and what can be done to really push that along. One thing to note that I find it very striking is how telemedicine is being used. People are not seeking care necessarily with new doctors. They're seeking it with their current doctors. So it really just is a new way for them to talk to their existing professional partners there and to learn about their health and talk about diagnoses. without having to go meet them in person. It's the convenience factor. It's meeting them where they are. It's making it easier for them to manage their own health. So we can keep moving. We do know that telemedicine also played a major role this past year, especially in helping people address their mental health issues. When we asked how many of your telemedicine visits were related to mental health issues, we had 2 in 10 saying that it was. This is important, I think, an important trend to continue to track, because mental health professionals, as we know, some of those biggest barriers to getting care are finding a professional, getting one near you, getting time on their schedule. We're often hearing in other surveys that there's a month or 2 wait period to even get on the schedule with a mental health professional. So I think to the extent that telemedicine and some of these other newer ways to interact with patients can be rolled out and supported by employers, supported by carriers, it'll really make a difference in people being able to manage their own health. So Doug, I'll turn it right back to you here.
Sure.
Myself.
And you know, if anyone has any questions, I think now's the time to ask them. But I can kick it off myself, in part because I think the last topic that you were just talking about, Edna, is pretty fascinating. And I think it's the question with all of the technology changes that we've seen in the pandemic, whether, you know, we're talking about these Zoom conference calls that we're on, or you know, what have you. What do you think is the future for these telemedicine visits? Will this kind of trend continue as life goes back to normal? What might be the things that impact that being the case?
Yeah, great question. I think there's 2 aspects to it. One is the consumer interest in it is not going away. When we asked people who had started to use telemedicine for the first time during COVID, well, what do you think? Are you going to keep using it in the future? Almost half of them said, yes, we're going to keep doing that. So it's not, if there's any barriers or impediments, I don't think it will be the consumer side. There are, however, as I mentioned earlier, some regulation issues that really need to be resolved probably before it becomes truly as useful and helpful as it can be. And that's really around, you know, parity in payment for providers so that they can get paid the same amount of money visiting someone via a video visit versus in person. And I think we're seeing a lot of movement on that. So we'll continue to keep an eye out, but I would expect it to be a very sticky trend.
Anyone, any questions? I have another thought, and feel free to kind of put a question in the comment chat as well. In a project I did last year, it was with K through 12 workers specifically, and we surveyed them in May. We surveyed them again in October, and stress and burnout went through the roof comparing the 2 months. And it's not like the context of the pandemic was not stressful back in May. Obviously, the big difference was a lot of teachers going back into the classroom in person in the fall. Obviously, the pandemic context is a lot different right now, but I was wondering if Edna or Lisa, you have any thoughts about what the implications for this might be in terms of mental health, or what employees, employers might be thinking as the role towards more in-person work continues to move on through the year and going forward.
So I think on my end, at least, looking at the open-ended responses from that Rethinking Retirement study, which was very specifically about whether or not the pandemic had changed your plans for the age at which you wanted to retire. I saw several quotes from people saying, my employer's calling me back. Now, keep in mind, this is 50 plus. My employer's calling me back. My doctor has told me not to go back, so I retired. Or my employer's calling me back, I don't want to, so I retired. I do think that you know, the new balance of working from home and going back into the office may impact near retirees. I think we've seen a little bit of that. Most people are actually saying they're going to retire later, but there are a handful saying they're going to retire sooner for a variety of reasons.
Right, and I think from the, the CEHCS study does cover a much broader age range there, or at least that's what we're reporting on here in this webinar. We asked a lot of questions about what would make people comfortable returning to work. And I think the general consensus was about half of people said, yeah, I'm happy to do a temperature check at home, at work, show proof of that. A slightly lower percentage were willing to take a COVID test and show that it was negative. But really beyond that, I think that health is going to remain a very personal issue, and they do not want, to the extent that employers start getting more invasive with tracking or verification of negative tests and things like that, they're not going to be okay with that. And I think we've seen a number of reports about people either choosing to leave the workforce entirely or choosing to start up on their own, or choose some sort of career that allows them, the flexibility to do what they want. So I think that there's going to be a lot of change there, and we'll have to keep an eye on that for sure.
Hey, Judy, did you have a question? So we talk about all sorts of fun things here at Greenwald, but one that we didn't cover as we prepared for this, just curious to know anyone's thoughts. I've seen the emergence of sort of standalone app-based mental health benefits, right? And it seems to me that, combined with potential changes to employer-based insurance coverage, that may be something that we see gain a lot of traction. Edna, do you have any thoughts or care to opine?
We're going to ask a lot about that this year in the CEHCS study, so I'm excited to see that. I think apps in general and wearables have had a place. We've seen a decent percentage of people, not quite half, but a percentage of folks who do rely on their wearables. They like to do things like track sleeping, track weight management, track diet. I expect that will continue. So I think the mental health piece of it is something to certainly keep an eye on. But yeah, we're using our phones more and more, aren't we? Our phone is our doctor.
All right, any other questions or comments? Well, I think we're at the half-hour mark. Feel free to contact us if any of this is of interest. And some of the studies specifically that we were citing, we could give you more details on, or if this is just a topic that you would like to hear more about, we'd be happy to talk to you. But again, appreciate everyone attending. It's an important topic, and stay tuned for coffee breaks in the future. And thanks for joining today.